Or good evening. Hi, welcome everyone, and thank you to those joining us live and to those listening in afterwards. I'd also like to warmly welcome our guest today, whom I'll introduce shortly. This webinar is being presented today by the FIP Pharmacy Technician Advisory Committee. This group is made up of pharmacists and pharmacy support workforce and works toward bringing you educational webinars and work on special projects like a glossary and competency framework for pharmacy support workforce. Our webinar today is titled Digital Health and the Role of the Pharmacy Support Workforce. Digital health is transforming the pharmacy landscape, and the pharmacy support workforce play a pivotal role in this evolution. This webinar will explore the integration of digital health solutions within pharmacy practice, focusing on innovative methods to enhance patient care and operational efficiency. Participants will learn how pharmacy support workforces can leverage digital tools to optimize medication management, patient communication, and data accuracy by sharing real-world examples and best practices. This event, aims to empower the support workforce with the special skills needed to thrive in an increasingly digital healthcare environment. Next slide, please. My name is Kathy Schuster, and I'll be your co-moderator for today. I am a licensed pharmacy technician in the province of Ontario, Canada. I have many years of practicing in community and hospital pharmacy settings and in education. I'm currently the Accreditation Coordinator of the Pharmacy Technician Programs for the Canadian Council for Accreditation of Pharmacy Programs, or CCAPP. I have served on a number of pharmacy committees and boards, provincially, nationally, and internationally. I joined the FIP Pharmacy Technician Symposium team in 2015, and I am currently a member of the Pharmacy Technician Advisory Committee. My co-moderator today is Mohammad Umaid, and I'd like for him to introduce himself.
Thank you. It's very nice to be here. I would like to thank Catherine, and I would like to welcome all the members. So a brief introduction about myself. I am Mohammad, and I'm director at Al-Fateh Institute of Health Sciences in Pakistan, where I lead innovative training programs for pharmacy technicians to excel in digital health practices. Having double master's degree from Anglia Ruskin University, UK, I have over 4 years of experience in academia and research. Under my leadership, Al-Fateh has established partnerships with global industry leaders like IBM, Amazon, Snowflake, Cloudera, and Lenovo to integrate cutting-edge digital tools into healthcare education. As an advisory board member of both the International Pharmaceutical Federation and the Harvard Business Review, I contribute to global healthcare education strategies. An ASHP well-being ambassador, I also hold over 800 verified digital badges from more than 300 issuers via Credly. Demonstrating my commitment to continuous professional development, I bring valuable insights into how digital health is transforming the pharmacy technician's role. Thank you.
Thank you, Mohammed. Next slide, please. As you can see in this slide, we have some announcements. Please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and we will do our best to manage all of your questions. You are welcome to provide feedback on webinars at fip.org. I would like to take this opportunity to promote benefits of the membership with FIP, including events and webinars. FIP is a global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist, a pharmaceutical scientist, and you'd like to become a member, please register on FIP's website at fip.org. If you are a member of the pharmacy support workforce, you can also apply for membership. Next slide, please. So FIP has something new that they're using with their webinars, and it's a new translation feature on Zoom. If you'd like to try this, step 1, turn on your captions. Step 2, enable the translation toggle. Step 3, choose your preferred language under My Caption Language, and now you can follow along with live translated captions. For this event, we are joined by a panel of fabulous speakers, and I wanted to sincerely thank each of them for taking the time to prepare their presentations. For your program today, our agenda is as such. Welcome and introduction by the moderators. Digital Health Developments in Pharmacy, FIP's Policy and Actions, presented by Robert Moss, FIP Vice President, the Netherlands. Number 3 is Computer-Based Educational Tools, presented by Rosemary Colleen, Director of Lifelong Learning, University of Waterloo School of Pharmacy, Canada, and Kelly Grindrod, Associate Director, Clinical Education, Associate Professor, Ontario College of Pharmacists, Professor of Pharmacy Innovation of the University of Waterloo School of Pharmacy, Canada. And Digital Health in South Asia, Navigating Challenges and Unlocking Opportunities, presented by our co-moderator, Mohammad Umaid, Director of Al-Fateh Institute of Health Sciences, Pakistan. We will have Q&A, and then we'll wrap up with conclusions. There are a number of learning objectives for this webinar. Attendees will be able to identify the integration of technological developments into work processes can provide health systems in high and lower middle income countries. Learn how pharmacy support workforces can leverage digital tools to optimize medication management, patient communication, and data accuracy. And identify digital learning tools designed for the pharmacy team to support education and lifelong learning. Our first presentation is from Dr. Rob Moss. Rob, was trained as a hospital pharmacist in Haarlem, the Netherlands. He has worked in a clinical setting since. Rob works as a consultant in hospital pharmacy, helping improve patient care, optimize organizations, and educate hospital pharmacists and other professional staff. He is passionate about optimizing health systems by integrating new technological developments in work processes, both in high and low and middle income countries. He is an expert on medication shortages and substandard and falsified medication regulation. Currently, he is Vice President of the International Federation of Pharmacists, FIP, and member of the FIP Technology Advisory Group. In all his capacities, he strives to contribute to improve hospital pharmacy services and health outcomes at national, European, and global levels. One of Rob's current assignments is as a senior advisor of critical event preparedness for the Dutch National Medicines Coordination Center. Please welcome Rob Moss.
Thank you so much for your introduction, Catherine, and thank FIP for allowing me to speak at this interesting webinar. It's great seeing so many 161 participants. It's really amazing. The interest that is here for digital health developments, because that is the one thing I think is really changing, the major changers in our profession. So I'm glad that this part of the webinar, I can give you some background on how FIP's policies and actions contribute to knowledge about, but also integrating digital health developments in the pharmacy. Yep, just one sec. There we go. Just for the ones who might not be too familiar with FIP, the FIP has set up development goals, which are key resources for transforming the pharmacy profession globally, regionally, and nationally. And these development goals are in alignment with the wider global imperatives underpinning the United Nations Sustainable Development Goals. Within all these goals, if we focus on the number 20, which is all about digital health, and the digital health development goal is informed by and overseen by the FIP Technology Advisory Group. We usually call ourselves the TAG. So if you look closer at these development goals, you can find them at the website. And they always look at three parts of the development goal. What is there for workforce and education? What elements are there? And this is to facilitate the development of and a digitally literate pharmaceutical workforce for the digital health part. The practice part, very important for you too, is really what structures and systems are there in place to develop and deliver quality digital health and pharmaceutical care services. And there is also the part for the science, which I will not elaborate on at this webinar. So, as I mentioned, the Pharmacy Technology Advisory Group is the part that advises about Development Goal 20. And what is the FIP Technology Advisory Group? It's a group made up of members, FIP members, with expertise and or interest in areas related to its scope. And the group is led by two co-chairs, Lars Åke Söderlund from Sweden. People who've been to digital events on digital healthcare by FIP I'm sure are well known with Lars Åke, and myself, Robert Moss from the Netherlands. We meet bi-monthly and organize business plans and deliveries. You can find more about it if you scan the QR code. So what are our objectives? We provide ad hoc technical expertise and health technology matters to FIP and its members, but not just to FIP and its members, also with FIP's collaboration, expertise for FIP's collaboration with partners, a very important one being WHO, and we advise on what health technology can mean for pharmacy profession. We explore the global initiatives and developments in health technology and the impact that they can have on the role of pharmacists. And therefore, we keep abreast with trends in health technology, what their effects on pharmacists in different settings could be, and we look at emerging opportunities for the advancements of pharmacy and new roles. We outline trends in technology and their effects on pharmacists in the different settings and provide guidance and education for FIP members on health technology. And of course, we facilitate the gathering and sharing of best practices, part of which is this webinar, in relation to health technology development and the implementation, particularly as it applies to pharmacy. So what are our focus areas for 2024-2025? We look at the digital trends in pharmacy and healthcare. We look at advancements and digital uses of medical devices and digital therapeutics. Then, of course, we keep an eye on market disruptors and their impact on patient care and pharmacy practice. Think about sort of what we call the Amazonification of healthcare, of pharmacy. We look at the use of technology to support pharmacy education, pharmacy practice, and pharmaceutical science. And we look at the impact of mobile health and wearable technology on pharmaceutical practice. Very important if you're talking about data and looking at different systems is looking at standards and terminologies to make sure that systems can speak to each other. The interoperability of systems is very important to maximize the effect of digital developments. And of course, we look at the best standards, best practices and standards in health information technology. And very, very timely and very upcoming is, of course, the advancement and use of artificial intelligence systems in pharmacy and healthcare. Underneath or part of the technology advisory group, there are two working groups. One's on artificial intelligence and the other one's on data. And they advise the TAG and provide reports. So again, look at our activities. What are the most relevant topics to pharmacy technicians and support workforce that the TAG is focusing on? One is telehealth and telepharmacy, expanding remote pharmacist services and virtual care models, the Amazonification I just mentioned of healthcare. There are emerging commerce giants and online platforms that work in the field of healthcare and pharmaceutical care. So we look at automation within pharmacies and hospitals. How will these developments in automation and affect pharmacy technician and support workforce and enhance their roles? and what will there be a redefinition of their roles because of it. And again, artificial intelligence, applying AI and machine learning in areas like medication management, clinician decision support, and pharmacy operations. And of course, another big trend going on outside of pharmacies that we can use are the digital therapeutics and wearables, assessing how new digital therapies, for example, apps treating chronic conditions and wearable health technology can ensure pharmacists can make sure that pharmacists use them and that we are prepared to counsel patients on their use. It's a broader role than just looking at medication. So what are our activities? We do reports on technology. We deliver regular digital events, webinars. We have courses and a book on digital health, and there's an FIP, artificial intelligence toolkit for pharmacies. So examples here, and they can be found on the FIP website. One was on online pharmacy operations and the distribution of medicines, on digital health in pharmacy education, but also on mHealth. So please feel free to browse the FIP website and make use of these reports that are there. Webinars, there have been several webinars over the last couple of years. Interesting part, shaping the future of self-care through pharmacy, and what does self-care mean in the digital age? Digital health in a changing care delivery for pharmacists and improving public health. All these webinars too, you can view on the FIP website, and please feel free to browse them and learn from them. Courses that are offered, and there'll be some information about that at the end of the presentation too. There's a digital health in pharmacy, an online course for educators and practitioners that you can learn from and enroll, of course, if you are an FIP member. But there's also a trainer course for educators in digital health, and a very interesting book can be bought on pharmaceutical care in the digital revolution, and demonstrates how blending human and digital pharmaceutical care can establish what they called an apothecary intelligence, of which you as pharmacy supports are part. Also just recently launched is the FIP Artificial Intelligence Toolkit for Pharmacy. Another program that the Technology Advisory Group sets up is linked to the World Congress that is held annually. And next one will be in Copenhagen in 2025, and I really hope you will join us. But just prior to the official FIP Congress, there is a satellite digital pharmacy summit. And if you scan here, you can find more information about the digital summit. Very interesting program. Of course, a keynote by really, we can't disclose him or her yet, but it'll be really capturing the essence of digital pharmacy and the possibilities there. Then will be a session on capturing and use of data in pharmacy practice on healthy aging, how technology can help leverage the quality of life in a community, and 24/7 pharmacy services to patients running in the background or run by pharmacists, but at least available everywhere. And digital health and the AI in action, preparing pharmacy for delivering digital health at scale. Well, I do hope I made you feel that it's something you would like to attend. And I really do say, please try to attend it. It is a separate from the course, but you have to register for this. But you will learn and learn actionable strategies for helping improve patient care, workflow efficiency, and integrate new technologies like AI chatbots into daily practice. Having said that, we of course also hope that you will join us at the FIP World Congress, where the TAG has at least 3 sessions that we have organized on real-world impact of digital health, predicting the future with data, and remote patient monitoring and digital measures in clinical trials. So we hope to see you there, and I hope you enjoy the rest of the webinar.
Thank you, Dr. Robert Moss, for the great knowledge that you have shared. And now we will carry on this excitement to the next session, that is computer-based education tools. And we have got two tremendous speakers, and let me introduce them to you. So the presenters are, the first is Miss Rosemary Kelleen. Rosemary Kelleen is Director, Lifelong Learning at the School of Pharmacy, University of Waterloo. In this role, she oversees the design and development of professional development programs for pharmacists and other healthcare professionals and acts as editorial and operations lead for the Pharmacy 5 and 5 project. Graduate of the University of Toronto Faculty of Pharmacy, Rosemary also holds a postgraduate certificate in public health, specializing in health promotion from the London School of Hygiene and Tropical Medicine. She has practiced in settings including primary care and community pharmacy and served as editor in chief and deputy publisher of the Canadian Pharmacist Journal. Rosemary's areas of interest include educational research, health literacy, recognition of prior learning, and the use of technology in education. And along with her we are pleased to welcome Dr. Kelly Grindrod. Dr. Kelly Grindrod is a full-time faculty member who researches the role of mobile health technologies and social media in medication m- management. She is also interested in how digital technologies can be used to change clinical practice. Kelly also leads the clinical education team at the University of Waterloo School of Pharmacy and teaches therapeutics and professional practice in the PharmD program. Kelly obtained her Bachelor of Science in Pharmacy at the University of Alberta and then completed a hospital pharmacy residency at Western University in Ontario. She then went on to complete PharmD and Master of Science in Pharmacy degrees at the University of British Columbia. Kelly is a registered pharmacist with the Ontario College of Pharmacists and is the founder, principal investigator, and content lead for the Pharmacy 5 and 5 project. I welcome you both.
Hello, and thank you very much for having us. We're coming to you from Waterloo, Ontario in Canada. And I'd just like to start off with a small land acknowledgement that we acknowledge that we live and work on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. The University of Waterloo is situated on the Haldeman Tract, the land promised to the Six Nations that includes 6 miles on each side of the Grand River.
Okay, so you just heard the intro of Rosemary and I. We've been working on what we're going to walk you through, which is a micro-learning platform that we created several years ago. We've been working on this since 2018. Next slide, Rosemary. So we're going to be talking about something called Pharmacy 5 and 5. We built this early on because we were meeting pharmacists in Canada. Some of you might know, and in some of your own homes, you might have a rapidly expanding scope of practice. So pharmacists have a rapidly expanding scope of practice. And we were finding that as things would change, it was really hard to wrap their head around what it was that they were going to be doing. So, we could ask them questions, we could teach it in class, we could do continuing professional development events. And they would give us the right information where we'd say, are you allowed to do this or can you do this? And they'd say, sure. But we had a really hard time getting them to switch that to, and I could do it, and I will do this, and I want to do this. And so as the pharmacist scope of practice has been expanding, technician's scope of practice has been expanding alongside it. So we've been creating now for several years information for technicians and pharmacists on really kind of this modern pharmacy practice that we have here in Canada. So I'm going to take you through an intro of what 5 and 5 is, thought you might be interested in what topics are most relevant to pharmacy technicians, because they're a little bit different than pharmacists, not always what you'd expect either. Where we've had some really good successes and where our main challenges are right now, and then opportunities we think we have going forward. So in terms of our successes to date, like I said, we launched in 2018. We now have over 22,000 users who have registered for the platform. It's interesting because technicians make up almost 10% of that. Technician students make up about 16% of that. That's largely because we do have technician college programs who do have their students register and complete some of the modules, especially around scope of practice. Just under half are licensed pharmacists. We hear a lot from pharmacists who are new to Canada and who use this to learn how to get up to speed, because Canadian scope can be quite different from countries where they've come from. A number are pharmacy students, and of course there are others. We like to say we were doing micro-learning before it was cool, because really this is meant to be 5 and 5 means, can you learn 5 things in 5 minutes or 5-minute chunks? So a lot of the content is stuff that you can look at quickly, refer back to, download, print. It's not just a webinar, for example. It's an infographic that no matter what, when you're off the platform, you print it and it sits beside the computer in your practice. In terms of others, we did a lot, actually, even off the platform during the pandemic with COVID, a huge amount that needed to be done around vaccine information with the public, rapidly evolving information. So we made a lot of material that was downloaded over 100,000 times. We've done over 50 modules now to date, 7 of which we've done, the formal accreditation many countries will have, where you can get credit. We've won awards for how we've been able to share this information on social media, for example. And then we've also taken a lot of our tools and published them in medical journals, because they are practice guides, both micro-learning and then that traditional format of reading a medical journal.
So here's some examples of the topics that we do cover. And as you can see, it's quite broad. We do everything from the scope of practice changes, as Kelly mentioned, best practices in things like documentation or narcotic inventory management. And then we also do cover some strictly clinical topics, dermatology for diverse populations, how to administer naloxone, for example, as well as some what some people would call soft skills. We've got into recently on leadership topics that are applicable to anybody in the pharmacy workforce, and those have been well received. We've published only in the past year the ones on negotiations and leadership models. We typically publish between 6 to 8 modules each year, and cover topics that are, as Kelly mentioned, of interest to both pharmacy technicians and their students, as well as pharmacists and pharmacy students. So this is what it looks like when you come to our module landing page. And these are some specific ones that are of interest to technicians. So some of them are very jurisdiction specific. I know Kathy, our moderator, said she was a technician in Ontario. So that's one of our provincial jurisdictions where pharmacy technicians have a very defined scope of practice. So we do have a module outlining that. As well, we find that technicians are interested in a number of the other clinical topics, as well as things like how to adjust medication during Ramadan. And the platform is optimized for mobile devices, and our data tells us about 50% of our users access the content through their mobile phone. So a recent analysis of our data shows that these are the topics most popular with pharmacy technicians and technician students. So again, they may not be the ones that would jump immediately to mind. Influenza vaccines, pharmacy technicians in Ontario do have the legal ability to administer vaccinations if they have received appropriate training. So that one is not a huge shock to us, but we know that scope may be different in other jurisdictions. Assessing opioid prescriptions, medical assistance in dying. Of course, we have legalized cannabis in Canada, so that is of interest to technicians. And some of the topics that you see marked with an asterisk are assigned as homework in some of the technician training programs, particularly in Ontario. So we do get feedback from the technician training programs and the instructors there about how their students are using it or which topics they're assigning in particular to their students as part of their curricular materials. So part of what we do that's different from a traditional continuing professional development or education program is we use multimedia elements as the content, which I'll put in air quotes. And that's how the content itself is delivered. And then the assessment component comes in sort of fun quizzes that people can do on the platform at their own time. So as Kelly mentioned, it's intended to be done in small chunks, so very much a micro learning intention. But this is an infographic that was developed specifically for the pharmacy technician scope of practice module. And this is downloadable, so it's in a PDF format that people can download and print and then post up, for example, in their pharmacy if it's something they want to use and keep as a resource. But it can, clearly outlines, with hopefully helpful graphics about what are the elements of practice that pharmacy technicians can do. For example, transferring a prescription from one community pharmacy to another if a registered technician is involved. And then the things that they can't do, like you can't provide patient education on a clinical element, and some helpful reminders, don't forget. And as well, some reference information is included as well.
So here's an example of a more modern infographic, the one you just saw we made earlier in the platform. This is something we made more recently. This was a topic that I taught my students for many years. We do an annual negotiations workshop. But something that we've learned is, technicians in recent years are highly, highly in demand in Canada. And it can be very hard for pharmacies to find that. So they're getting an opportunity to negotiate contracts as well. And so this is an example of something that kind of spans any user. And there are multiple infographics and flashcards, which I'm going to show you in a minute, and questions that give tips on how to get the best out of a negotiation. This is an example of what we call a flashcard. These are small graphics. They're easily shared on things like social media, but they're also meant to be almost like PowerPoint slides that people can flip through. They could download the set of them if they wanted. We usually have several of these with, as Rosemary had said, nice graphics. And like in this case, it's documentation, and it's reminding people that any note that you send off to a physician's office gets added to their EMR. So the documentation module is a lot about medical liability, for example. It's not just daily practice, but it's also the broader risk context in which we work. Here's another one that was a really interesting topic. So it was a module on how to adjust medications during Ramadan. Rosemary and I worked at a clinic where a number of our patients were fasting, but a number of our physicians and nurses were also fasting. And as we heard them talk about how challenging it was to know what to do, we worked with the big team to then put together an infographic on this. And again, so you just see it's another version of our flashcard. This is a more modern one. This is a module on frailty that we created. And this was one that surprised me because I had thought this would be much more of interest to pharmacists and students, but we actually got feedback from technicians that this was very much up their alley. Technicians are often the folks who spend a lot of time with seniors, blister packing, compliance packing, et cetera. So this was relevant to them. And you can see this is newer ones, so the graphics are getting a bit more modern. We had done one as well with the folks in Canada nationally who regulate the narcotic inventory, because there are a lot of challenges with pharmacists not navigating or managing inventory correctly. So it's not necessarily intentional. It's just that what they had done over the years to watch for things like missing narcotics wasn't actually working because they didn't know which to check. And so we had another module that again was quite useful for pharmacists and technicians, showing just all the various ways you might not realize you need to track your inventory. And then lastly, this is an example of a video. We won't play it, but each of these modules has a video. And again, like I was saying, this is the frailty module where there was a lot of interest from technicians, because a big part of this was actually explaining who all the different members of a team are when you're caring for patients with frailty, including what is the role of the technician and how it's distinct from the pharmacist, distinct from the nurse, distinct from the physician, distinct from physical therapists. And so usually we'll have an animated video among them.
Great. Excuse me. So the content in the multimedia components is complemented by a very unique instructional design in how we assess people's knowledge, or it's actually a self-assessment that people do when on the platform. So here's an example of an actual question and answer from what we call the fast facts set of questions. So this we use as sort of a self-assessment, so people can do some quick knowledge-based questions, get answers right away, get some feedback on whether they got the answer correct or not. And we suggest that the users do this as a knowledge check, see if there's any gaps in their knowledge, and then go to the multimedia content elements to see where they need to learn specific elements to fulfill the learning objectives. And then from there, they can proceed on to the case-based or scenario-based questions. So the intent of this design is actually quite unique and intended to help foster confidence in applying the knowledge. And we're using some behavioral modification behind the scenes, as well as some gamification. You can see that we let them know 92% of people answered the same as you. We show them, you got 5 out of 5 correct. So they get a little, flame there to show how well they've done. And it's intended to make the overall learning experience kind of fun. And as well, they can do, 5 quick questions at a time, so that it's very much intended to be something they can do quickly, as we said, access on their phone. But from an assessment point of view, it's using both formative and summative technologies or methodologies as part of the assessment. And there are as well some reflective questions. And here's an example. At the end of a scenario-based quiz set, there will be a reflective question that's related. And there are different questions for pharmacy technicians as compared to pharmacists. And in this case, it would say, in the past 3 months, this is from the documentation module, have you used one of these documentation formats for documenting notes? So this is very much intended to get them thinking, have I used this? Is there a place for me to use this in my practice? Scenario-based questions plus the reflective question before they can get their feedback and get the answers. And very much there are a lot of resources and links provided in the answers that again are part of the fulsome learning experience for them. Because we're trying to make it easy for people, the platform automatically generates a statement of completion when they achieve 70% or higher on the set of quizzes or for the module. And then, for example, with students, they can upload this to the learning management system if it's been assigned as homework or an assignment from their instructor.
Okay, so where we found this works is these kind of opportunities to come in, learn at your own pace, very interactive. One thing you'll notice is we talked about it being gamified, but it's actually not competitive. We had tried competitive features at the beginning, leaderboards, things like that, and we learned pharmacists are very collaborative. Their personalities generally don't lend themselves towards competition. What they liked is reassurance. They didn't mind peer comparison. So if I answer something correctly and most people answer it like I did, it's an easy question. If I answered correctly and most people didn't get it, I know more than they do. If I answered incorrectly, everybody else got it wrong. Well, we're all in the same boat. It was a hard question. Or if I answered incorrectly and everybody else got it right, oh shoot, I'm the one who's behind the curve. So there's little that seemed to work a lot better than saying like you're winning, you're the top. When we think of popular apps like Duolingo and things like that, where people sometimes engage those features and sometimes don't. There's a lot of research in the game-based education space around how just because a feature exists doesn't mean your type of learner needs that feature. So that's a lot of the background we're trying to figure out is, so for example, what's a technician like? What's their learning personality? Would be an important question as we have digital innovation. So where we're really interested in resources like this is filling knowledge gaps in the classroom, supporting experiential learning. Students get out on an experiential rotation. They don't know what they're doing. You can assign something like this to catch them up. CPD, and then also reaching rural and remote locations. And so I'll just very quickly go through the next 2 slides to set up our Q&A after. The biggest challenge that we have right now is who pays for this. It's very difficult to find a market among pharmacy technicians willing to pay for CPD and also to find industry sponsors who are willing to pay. We tend to avoid industry sponsors if we can, but it's getting increasingly challenging. Also figuring out which topics are most desirable. So if you go to the next slide, Rosemary, and this will be our last slide. In Canada, the national standards of practice that were updated a couple of years ago include checking lab values, both for technicians and for pharmacists. So the expectation is technicians would know how to get into the systems and document a patient's lab values, not interpret them, but record them. And so we're seeing, pharmacists or technicians, when we ask what are topics you're most interested in, again and again, what comes up is lab values. So this is also a challenge we're trying to figure out is I want to create modules that pharmacists can use for lab values. What's a version of that a technician, like how high up do we go knowledge-wise, and what do we focus on? So, and again, who sponsors, who supports, who pays for the development content, because this can be quite expensive with a graphic designer, hosting the platform, etc. Anyway, so I think this is roughly where we're at. Thank you for taking the time to watch the presentation, and later on we hope to have questions to answer.
Great. Thank you, both Kelly and Rosemary. This was a great topic for pharmacy support workforce across the globally. Certainly interesting for a project if anybody's looking to start up something for their pharmacy support workforce. It's the introduction of 5 and 5. It's been a huge success in Canada and a very innovative way for pharmacy professionals to continue their practice in lifelong learning in minutes. This was great. Thank you. We've already introduced Mohammad at the start of the webinar, and it's exciting to learn what's happening in other countries using technology. So I'm going to turn it back over to you, Mohammad, for your presentation. Thank you.
Thank you. Esteemed colleagues, members, and respected audience, I extend a warm welcome to this presentation on digital health in South Asia, navigating challenges, unlocking opportunities. My name is Mohammad Umaid, and as director of the Al-Fateh Institute of Health Sciences in Pakistan, alongside my engagement with organizations such as Pharmacy Technician Advisory Committee, FIP, and my certification in the Pillars of Global Health, PFHI, I have gained valuable insights into this evolving field. Today, we will critically examine the existing hurdles and the considerable potential that digital health offers to enhance healthcare delivery and outcomes across South Asia. I now invite you to join me as we delve deeper into this important subject. Next slide, please. Introduction to digital health in South Asia. Digital health is reshaping the healthcare landscape in South Asia. This broad term encompasses a variety of technologies, from telemedicine and AI-driven diagnostics to mobile health solutions and EHR systems. The adoption of these technologies has surged, especially after COVID-19, which acted as a catalyst for digital transformation. With the increasing internet penetration and massive population in South Asia, these digital health solutions are being leveraged to improve access to healthcare, particularly in rural areas. According to the data, India alone saw 500% growth in telemedicine usage during the pandemic. Countries are also investing in digital healthcare infrastructure to build a sustainable healthcare ecosystem. Next slide, please. Digital health in India. India's digital health market is booming, with projections indicating it will increase $37 billion by 2030, as noted by the NITI Aayog. Key initiative driving this growth is the Ayushman Bharat Digital Mission, which aims to digitalize healthcare services across the nation. With over 1.2 billion mobile connections, digital health solutions are reaching even the most remote areas. Telemedicine usage has surged, and now more than 80% of Indian doctors are using telemedicine platforms for consultations. The use of AI in healthcare diagnostics and data management is also rapidly growing, improving accuracy and efficiency in treatment and decision making. Next slide, please. Telemed digital health in Pakistan. In Pakistan, digital health is making significant strides, particularly in telemedicine. The market is projected to grow by 17% annually between 2023 and 2028. According to TechSci research, one of the most impactful platforms is Sehat Kahani, which has connected over 7 million patients to healthcare professionals. The government is also playing a key role with the launch of the digital health policy, aiming to regulate and foster the growth of digital health solutions. Interestingly, mobile health apps are gaining immense popularity with usage expanding rapidly in both urban and rural areas. Next slide, please. Digital health in Bangladesh. Bangladesh, with over 125 million mobile users, has embraced mobile health solutions as a critical tool for healthcare delivery. The government's digital health strategy 2023 is aiming to bring AI-driven diagnostics into public healthcare to improve decision making and patient outcomes. The use of telemedicine surged during the pandemic, with over 20 million consultations happening in 2020 alone. Fact, the Bangladesh Digital Health Initiative is now expanding across the country, focusing on improving maternal and child health outcomes, especially in rural areas where healthcare services are scarce. Next slide, please. Digital health in Sri Lanka. Sri Lanka's digital health transformation is marked by the widespread adoption of electronic medical records, EMR, with over 90% of government hospitals using them as of 2023. This is a significant achievement, making Sri Lanka one of the leaders in digital health in the region. The country is also using AI powered predictive analytics to identify health trends, which helps in managing resources and preventing outbreaks. With over 30 million mobile users, M-Health services are expanding rapidly, and Sri Lanka's e-health strategy is focused on scaling these solutions across the country. Next slide, please. Digital healthcare in Nepal. Nepal, country with majestic mountains and a strong vision for universal health access. In pursuit of this, Nepal launched the Health for All strategy, anchoring it with digital infrastructure. Their national e-health strategy provides a blueprint to transform healthcare delivery through digital tools. Over 60 districts now offer telemedicine services, empowering remote consultation in challenging terrains. The Swasthya Seva mobile app provides real-time access to healthcare guidance and digital consultation, especially during emergencies. Nepal use of DHIS2 for disease surveillance and maternal health has made real-time reporting a reality even in hard-to-reach regions. Yet, infrastructure issue persists. Frequent power outages and shortages of trained IT staff in rural clinics pose ongoing challenges. Next slide, please. Now to Afghanistan, country where delivering healthcare service itself can be a heroic act. Despite deep challenges, Afghanistan turning to digital health as a means of hope. Their Ministry of Public Health developed an e-strategy in 2020 aiming for a national health information system. The basic package of health services now include telemedicine programs. Mobile phones are proving to be lifelines. Programs are sending SMS reminders to ensure maternal care appointments and TB medication adherence, especially important where physical access is limited. WHO and local NGOs operate remote digital surveillance tools to track outbreaks even in conflict hit provinces. Still, instability, damaged networks, and a shortage of trained staff remain major hurdles to achieve scale. Next slide, please. Digital health in Bhutan. Bhutan's path to digital health is as serene as its Himalayan landscapes. With policy support, Bhutan has built a small but powerful digital infrastructure. The flagship telemedicine network connects over 50 hospitals and basic health units, reducing travel needs for patients in mountainous regions. The EPIS system is central to better clinical care, enabling doctors to access patient histories instantly. When COVID struck, Bhutan led the way with Bhutan vaccine system, managing vaccination through real-time tracking. The Bhutan Health Trust Fund ensuring digital projects are sustainable, financed, though scaling is still constrained by rural internet limitation and a lack of ICT skilled personnel. Next slide, please. Ladies and gentlemen, welcome to the Maldives, country made up of over 1,200 islands, where geography itself is the biggest healthcare barrier. To bridge this divide, the Maldives has launched national telemedicine services aiming to deliver quality care across remote islands. Clinics are now beginning to use video consultations to connect patients with specialists. One of the most adoptive moves come during the COVID-19 pandemic, where the Maldives used popular platforms like WhatsApp and Facebook to provide the emergency digital consultation. It wasn't perfect, but it was fast, scalable, and life saving. In terms of health data, the government introduced the DHIS2 healthcare system in 2020. This now supports real time maternal and health monitoring, big step forward for public health outcomes in isolated areas. Despite progress, significant challenges persist, including limited internet infrastructure on remote islands and a shortage of skilled IT health professionals. These hurdles must be overcome to make digital health truly inclusive across the country. Next slide, please. Challenges in digital health adoption. While digital health in South Asia holds great promise, several challenges persist. Infrastructure issues such as unreliable electricity and poor internet connectivity are particularly evident in rural areas. Moreover, data privacy concerns are a major barrier, with patients and healthcare providers hesitant to embrace digital health solutions. There's also significant digital literacy gap, preventing both patients and healthcare workers from fully leveraging available technologies. High costs in rural areas and resistance to change from healthcare providers further complicate the widespread spread adoption of digital health. Next slide, please. Future prospects of digital health in South Asia. Looking ahead, the future of digital health in South Asia is promising. Governments are continuing to invest in digital health infrastructure, and there is growing collaboration between the public and the private sector to scale solutions. AI and machine learning will play a pivotal role in transforming healthcare delivery, especially in diagnostics. The digital health market in South Asia is expected to grow at a robust 18% CAGR through 2030, which indicates bright future for digital health across the region. Next slide, please. Conclusion. To conclude, digital health is revolutionizing the healthcare sector in South Asia, improving access to care and transforming how healthcare is delivered. Although the challenges remain, particularly around infrastructure and data and digital literacy, the region's growth potential is immense. With ongoing investment, technological innovation, and public private collaboration, South Asia has the opportunity to lead the world in digital health solutions. Thank you very much for attending this. I hope it was beneficial for you. Thank you.
Thank you, Mohammed. That was very interesting, and to see what's happening in other countries, especially in digital health and telemedicine. Most of us are so naive as to what's happening around the world. So thank you again, Mohammed, for giving us a little bit of a view of what's happening in South Asia. So we're going to take some questions from the audience right now. So if you have anything and you want to add them to the Q&A tool, we'll try and pick them up for you. But Mohammed is going to look after some questions that have been presented already. Go ahead, Mohammed. Oh, you're muted, Mohammed.
Sorry, thank you very much, Catherine, for your kind comments. And now we will move forward with the question and answers session. So here is the first question is from Dr. Rob. So Dr. Rob, the first question asked is that how can pharmacy support workforce get involved in the FIP work on digital health?
Okay, Mohammed, thank you so much for asking that question. Well, first and for all, you can sort of access most of the documentation within on the FIP site. If you become a FIP member, you can go more to the more in-depth reports that are there. But if you would really be active in the FIP technology advisory group or things like that, there's an application every year. There, of course, there's a limited time period that you can serve on the technology advisory group. So every year there is a refreshing of participants in the technology advisory group. So if you are interested, keep an eye on that, and you can apply. Actually, this year we had 3 vacancies, and we had over 30 applicants for the positions. So there is a lot of interest in becoming part of the technology advisory group, and we of course welcome interest from all over the globe and from all over the parts of the profession. So I think that would be very interesting pharmacy technicians or pharmacy support workforce to have that on and to have that view, because learning what I've learned now from this webinar, it's very interesting, and that field, that view should be part of the technology advisory group. So I
Thank
hope
you.
that answers your question.
Thank you, Dr. Rob. We have two more questions for you. The other question is that how does the work of FIP tag contribute to the UN Sustainable Development Goals?
Wow. Yeah, this is interesting, because what we usually do, if you look at the Sustainable Development Goals, and if we look at pharmacy, we very often and rightly sort of link it to the goal number 3, which is, of course, healthy lives and promote well-being for all. But the interesting part that, in fact, digitalization helps in many of the different other key sectors here, because digital health drives equity, it drives access, and it drives resilience. So it's more than just the global the health SDG number 3, but it helps in sustainable cities and communities where digital health contribution can help in, well, getting more connected people, and digital use can be used for urban disaster response and triage. And very important, I think it can reduce inequalities, because digital health makes it possible to reach out to parts of countries or countries in general that are normally not easily accessible. So I think it contributes to a lot of things. And of course, this development goal number 9, the industry, innovation, infrastructure, remote clinics, infrastructures that you can think of, getting connectivity of the rural areas, and have health data platforms like you've been describing in your presentation is very interesting. So you can really measure progress too, once you have the data. So I think it's far wider than just health.
Thank you. Thank you for your answer. And the last question will be, what will be the biggest challenges and opportunities of the digital transformation for pharmacy technicians and or pharmacy support staff?
Well, that's a huge question. And I
You
think
could
we
just
should all
briefly
be
answer
answering.
it.
Yeah, I think we should all
Yeah.
be answering that. Well, I think that the big opportunities, of course, are that it can expand your role. You can make the role better. You can have technology, you have more information, you have proper data, so you can also, the roles that you take, you can prove what you're doing or show what you're doing in outcomes. So I think that is really the opportunity. It opens up a lot of work, and a lot of the repetitious work could be done by automation, if you're talking about automation within, say, hospitals. But then it comes to the part where humans have the added value over machines. And that's the part that we should be looking at. How can we help it, technology? How can we embrace it, that it advances our roles? And I think you mentioned it very clearly in your presentation, what the main challenges are, is having that infrastructure, making sure that everybody can access it. And I think that will be the biggest challenge. And I think a big challenge of AI is that you really, really, really have to make use of it, but know its limitations, because it's very easy to trust a chat GPT or anything, but really, really do the fact checking. And that's what pharmacists, technicians, pharmacy support staff should be doing. They are the ones with the knowledge behind, well, information that comes out of the system. I hope that's covers a bit of the question.
Thank you, Dr. Rob. It was really awesome, and you provided a lot of insight and shared the knowledge. Now we would like to move to Dr. Kelly and Rosemary for the questions. So, so Rosemary and Dr. Kelly, the first question from you is what kind of feedback have you received from technicians or technician students regarding your content? Rosemary and Dr. Kelly, please.
Yeah, so when we do modules, especially anything that goes through that higher level accreditation format, we always have to do a survey to get feedback, and it's very positive. And this is again what surprised me, because when we make content that originally sometimes we have pharmacists in mind, but we make available to technicians, I don't always expect it to land. You know, I don't know that it's going to be interesting because it can feel very clinical when I'm making it. But actually, the feedback has been very positive. One thing we hear consistently, and Kathy actually could probably speak to this, is there's a real shortage of continuing education for technicians, which is a real problem when your technicians have this expanding scope of practice and greater responsibilities that's happening really quickly. So in a lot of cases, I think, from what I'm understanding, they're relying on what's designed for pharmacists rather than technicians. So a lot of what seems to be the most relevant to technicians is very practical, very applied and day-to-day, very much what am I and am I not allowed to do, but also interesting examples that might change the way they think about what they are and are not allowed to do. So in Canada, we have point of care testing, you know, the mobile devices that you, like they're in the pharmacy and you can take a blood sample and get a lab result right away. And technicians actually can do the test. They don't decide who gets the test. They don't interpret the test result as good or bad, but they can do the whole process with the patient. They can also take over a lot of the management of diabetes. So for example, the continuous glucose monitoring, the technical equipment, that's really much the domain, very much the domain of the pharmacist. So that's part of what we're seeing is what they really want, from what I see, is practical. I don't know, Rosemary, if you want to add to that.
Yeah, no, 100% agree with Kelly. And specifically, we get feedback about how much they like the multimedia resources, the videos or the infographics or those electronic flashcards. And we've had a couple of questions, I know through the chat or the Q&A box, about how some of our listeners today can access those things. So I've put it in the Q&A box. There's two things. There's open access on the University of Waterloo website about where some of our resources are posted. So those are YouTube videos or things that you can download. So there is a link in the Q&A box where there are resources, or maybe in the chat. I also posted some of our publications that we've done with some of the educational research we've conducted about the platform and users' experience on the platform. The Pharmacy 5 and 5 platform itself, you have to access through a browser. There is no app. So some of you looking for it on the App Store, it's not there. And we put the link to it there, but it is a Canadian domain. And when you register for the site, you will need to enter a Canadian address just because it is set up for Canadian users. So when it asks you, are you a pharmacist or a student or whatever, you can put other, and you can put in an address that fits a Canadian address. Probably the province of Ontario will give you access to the most content if you want to have a look around and see what's there. Some of it is open access and free, and some of it you have to pay a subscription to access. So that's the premium content. But there is a
Thank you,
frequently asked
Rosemary.
questions segment there that you can have a look at, and that will help you navigate.
Thank you. Thank you for your answer. It was quite knowledgeable. Well, the last question from your team is that, are you aware of any other computer-based educational platforms available to pharmacy technician?
In
No.
Canada, oh, sorry, go ahead, Kelly. Yeah.
No, but I was going to say one thing that I find really interesting is listening to Dr. Moss and then listening to you as well, where you've talked about a lot of all these different places around the world. And, one of the ongoing challenges, rural, remote, accessing, it could be information. One thing that we've often wondered is with a platform like 5 and 5, you can design it and it should be accessible anywhere in the world with reliable internet, especially when you're getting into spaces that are rural and remote, where it's difficult for someone to get into a conference, right? That the Big Netherlands conference is coming up, but there's going to be a lot of pharmacy technicians who don't have the ability to travel to that space. And that's something we've often had in mind when we're designing. So no, I'm not familiar, and Rosemary can answer too. But one thing that I think is when you have a platform like what we've designed, you almost need to have it out there. And then someone like you, Mohammed, or you, Robert, look at it and say, oh, you know what? I think this could be applied in my region in the following way. It's very hard for us in Canada to understand or to know what's needed the most. But if it's, for example, interoperability standards, I saw someone ask the question in the Q&A, we would never create that for pharmacy technicians in Canada. They just wouldn't necessarily, that's a very niche area. But if that's a big area of need and another community that technicians are working on, then we need to be told that and then help deploy that in a space like that. So ours is a platform, but it would be very interesting to hear if there's ways it should be adapted for the broader global need, especially in countries like what you reviewed, Mohammed.
Thank you so much for your answer.
Great, great. Thank you both, or thank all three of you for your great answers. I do have a question for Mohammed, but I do have a comment from the Q&A. It said that they really love if digital health was really introduced in most underdeveloped and developing countries of the world, like Nigeria. And I think that, again, what you talked about, Kelly, was, making that information available to people, and it's very difficult to do. But there's a niche there, and there's a role there for each of us on the FIP Pharmacy Technician Advisory Committee to start thinking about, and for FIP itself to think about some opportunities to provide this information and to sort of to help in making sure that this is available for countries like Nigeria. It's not fully adopted there, so it's very interesting, very good topic. Question
Can I
for you,
just
Mohammed.
comment on that too?
Sure, go ahead.
Yeah, because one of the things that I sort of personally really believe is that for lower middle income countries, in fact, there are the largest opportunities for digital health. Western systems, we've developed, I hate the term developing and developed countries, because I'm always asking, developing into what? Hopefully not into our systems if we would redesign systems, we would totally not design them the way we are designing them now. And with this new technology coming up, in the lower middle income countries, there are not some of the barriers to introduce new technologies because of interoperability problems in old legacy systems. So I would really think I'm very passionate about digital technology helping in specifically lower middle income countries, because you can leapfrog, learn from what has happened in high income countries, learn from the mistakes we've made, and then leapfrog there and introduce a new technology. And as you can hear, I'm passionate about that idea, but I really believe it helps.
You certainly are, Dr. Rob. So a question for Mohammed. How can South Asian countries leverage digital health to bridge the urban-rural healthcare divide, especially through empowering the pharmacy support workforce?
Thank you for your question. Digital health has the unique potential to reduce geographic inequalities in healthcare access, critical issue in South Asia, where over 60% of the population lives in rural areas, according to World Bank 2023 report. Pharmacy support staff are often the only available health advisors in these regions. By training them in digital tools such as telehealth triage apps, electronic prescription systems, and drug interaction databases, government can ensure safe and timely care. For instance, India's e-Sanjwani platform has conducted over 100 million consultations, according to Ministry of Health India 2024. Imagine its power if pharmacy technicians in remote areas become its frontline users. To make this sustainable, nations must develop targeted digital literacy programs for pharmacy assistants integrated into national health strategies. This transforms the pharmacy workforce into digital health ambassadors for millions. Thank you.
Great, great, thank you. And the next question I have is, are you aware of other computer-based educational platforms available to pharmacy technicians or the pharmacy support workforce?
I think so. That was for Kelly, that question.
That was for Kelly, sorry. Oh, okay, I'm sorry, yep. Yes, you're
Yes,
right.
yes.
So that's all the questions I have for you right now. Oh no, here it is. What policy innovations are needed across South Asia to ensure pharmacy support workforce staff are fully integrated into digital health strategies?
Well, thank you for your question. Well, right now, most South Asian countries lack formal recognition of the pharmacy support workforce in digital health frameworks. This is a missed opportunity. Firstly, there must be a policy shift toward licensing and digital upskilling. For example, Bangladesh Directorate General of Drug Administration has begun pilot projects where pharmacy assistants use mobile apps to track essential medicine stocks, scaling such as initiatives nationally could improve both supply chain and patient safety. Second, the regional accreditation standards for digital competencies supported by SAR or WHO CRO can help harmonize training across countries like Pakistan, Sri Lanka, and Nepal. This creates a qualified, interoperable workforce capable of supporting cross border telehealth platforms. Lastly, governments must fund and institutionalize pharmacy led digital health roles. Think of them not just as dispensers, but as community health navigators, especially in remote and under resourced areas. Thank you.
Great, thank you. So we're going to wrap up and conclude right now, and I think that we're almost at the end of our event. But so I'd like to ask our panelists to give one sentence practical take-home message for pharmacists listening. So if you wanted to go ahead, Kelly and Rosemary.
I think for me, I would say don't forget about the technician. They are core to drug distribution and delivery, have been historically underlooked, but as we look at presentations like Mohammad, remembering they're going to be core to access to medicines throughout the world.
Right. And just to follow on that, we can't assume that we know what they need in terms of learning materials or how they want to receive educational materials. So we really need to collaborate with them and invite them into the learning spaces directly.
Great, thank you. Robert, any messages for us? Oh, you're muted, Robert.
I think health technology, I think we all agree here, is coming at us. It is something that we cannot stop. So we have to embrace it and use it to really enhance our practice. And I think there's a great role for pharmacy workforce to take up new roles and really collaborate within the pharmacy, but with other healthcare professionals and in the community. And I really believe there's a big role for pharmacy workforce here.
Thank you, Robert. And Mohammed, do you have a message?
Yeah, sure. Well, I'll just say that digital health is not just technology, it is the lifeline to equitable, accessible, and future ready healthcare for every South Asian citizen and also every member of this world. Thank you.
Great, thanks. So Mohammed, you have a comment on the recording itself?
Yeah, sure. Next slide, please. Well, the recording of this episode will be made available on www.fib.org. Please provide your feedback to webinars@fip.org so FIP may continue to improve their digital event offerings. Visit events.fip.org for all future events. Next slide, please. To address the educational needs and priorities of our members in digital health, FIP developed the Digital Health and Pharmacy online course that aims to support educators in integrating digital health in our curriculum. Course is delivered online via FIPX. FIP's platform for online learning and is accessible to FIP members only. If you or any pharmacy educators are interested in taking this course, please scan QR code shown. Next, please.
Okay. So thank you, Mohammed. And this next slide is about the upcoming Congress in Copenhagen. I'd like to invite all of you to the 83rd FIP World Congress that will be held in beautiful Copenhagen from August the 31st to September 3rd. You can scan the QR code for more information. If you are planning to attend and you would like to get together and meet up, I'm trying to put my address in the my email address in the chat, but my email address is kathyschuster@gmail.com. Let me know that you're going to be available, and we can certainly meet up. There'll be a number of us that from the Pharmacy Technician Advisory Committee will be there, so it'd be good to talk to all of you. Some of the things that are happening. Next slide, please. Next slide. Okay, so some of the things that are happening are, the sub-themes for the event are making it sustainable. The second sub-theme is making the system work. And the third is making it personal. So again, there's some important dates to remember. Early registration is June the 2nd to 2025. That's the deadline. And then a second registration deadline will be August 11th, 2025. So plan to attend. It's a beautiful country and a wonderful place to be. It'll be summer, and hopefully we'll get some great weather and be able to enjoy our time together. So I'd like to again to thank, next slide, please. I'd like to thank my co-moderator, Mohammad, for joining me and for making this presentation most interesting for our pharmacy support workforce and for pharmacists who are joining in. Our last thanks to your attendance and our brilliant speakers, and we hope to see you soon. Bye-bye, everyone.
Thank you very much.